Okay, hi everyone. So my name is Lauren, and here today I have with me Vicki and Peter, and we're going to be doing a new kind of series on living well with schizophrenia, basically around just talking with people who are living with schizophrenia or schizoaffective disorder. So we're going to be covering a lot of different topics involving relationships, having a family, covering topics like medications and getting supports for your illness and that sort of thing. So we're going to be talking about a lot of different topics and covering a lot of different grounds and just getting some different perspectives on these kinds of issues and topics. So in this first video, we're going to be talking about what it's like living with schizophrenia. So we're going to be getting the perspectives from Peter and Vicki as well on just the day-to-day functioning of what it's like living with an illness like schizophrenia or schizoaffective disorder. So I guess the first question that we want to talk about is, how did you feel when you were first diagnosed? So Vicki, how did you feel when you were first diagnosed?
Well, I've gone through so many different diagnoses changing. I have schizoaffective disorder, bipolar type at the moment. But first I was diagnosed with psychosis, general psychosis, NOS. And this is when I was about 14 to 15 years old. So I didn't really know kind of like what to think. You know, I've heard like the scary word of schizophrenia because back then we didn't really have anyone tell us, like have mental health classes that, you know, showed us what it was about, and kind of there was stigma about it. And I was just concerned that I was different, and it was just kind of scary at the first part because I didn't know what was going on.
Yeah, totally. Did you have a similar experience, Peter? Or?
No, I actually felt relief when I got diagnosed because I had a lot of psychoses before that I was medicating with like cannabis and alcohol. So my first reaction was, oh, I finally got a label on these symptoms.
Yeah.
And then my second thought was like, I can't be one of those crazy killers. So I was stigmatizing myself that way. Mm-hmm. But overall, like relief that there could be a plan in place and stuff.
I think I kind of went through both of what you're saying. So like I was scared because of the stigma around the term schizophrenia or schizoaffective disorder. And there's just a lot of stigma around it. So I was scared about getting that diagnosis, but I also felt the relief that you're talking about, Peter, where it was like, okay, my symptoms are understandable, or like there's a reason for the symptoms that I'm experiencing and that kind of thing. So yeah. I think both those. I
think I kind of experienced the whole relief as well, but it was over such a span of time that I got so many different diagnoses that it was kind of like, okay, is this finally the one diagnosis, or is this? I'm still in the process of questioning my diagnosis and stuff like that as well. So it's kind of, I'm not sure if it's a relief or like if it's just kind of like, okay, now it's this. Is it going to change, kind of thing? Right?
That's important to talk about because I think that a lot of people go through that period of misdiagnoses. And so I know I was diagnosed with depression, then bipolar, and then schizoaffective disorder. And schizoaffective disorder was kind of the one that was like, okay, this fits. I don't know if...
For me, I was originally diagnosed with anxiety with depression. I lacked insight into how ill I was, so I just took the tranquilizers and antidepressants and carried on with my life. And then as more stress came into my life, I got more and more symptoms.
Right.
And then the first time I was hospitalized, at that point I was told I had schizophrenia. I was actually very fortunate because my psychiatrist actually pulled out the DSM manual and he described the symptoms I had, and then he said, do you agree these are the symptoms you have? And I was like, yes, absolutely. And he turned it around so that I could see it. He's like, this is what you have, and it was schizophrenia.
Right.
And then the schizoaffective came later, between 2003 and 2008. There was more monitoring, and in 2008 it was schizoaffective.
I actually bought the DSM because I just became obsessed with like figuring out what was going on with me and stuff.
I wanted to buy the DSM honestly because I was like, it's very interesting, or like just how different things can be and all that in the book.
Yeah.
Yeah, it's like an encyclopedia.
It's an encyclopedia for disorders.
Yes.
Okay, so the next question that we want to talk about is what your day-to-day looks like living with schizophrenia. So Peter, do you want to start with that one?
Okay, so my day-to-day, I usually am awake by 8:30. Then I have about half an hour to wake up from the medication fog. I test my blood sugar, and then I have breakfast. And then I'm either going to work or I'm at home, and honestly, because I'm going through not a lot, but some depression right now, I'll read books and stay off screen time. So I'll do that till about noon, and then at noon to 1, I'll have lunch, and then I'll start contacting people. Now, if I have stuff planned, I usually plan it for the afternoon because that's when I'm most alert. So I'll go out, shop. I like to shop almost every day just because it gives me something to do, and it's kind of interesting to see all the different people. And then I'll have a snack, and then I'll have supper. Supper times, more contact family and friends again. And then around 11 at the latest, I'm taking my medication and going to sleep.
So it sounds like you have a lot of routine
Yes.
packed into your day.
Routine with flexibility as well, because I work at the Schizophrenia Society, so that's 1 to 4 shifts a week. So there's that. I see my son on Saturdays, and I contact my daughters once or more times a week as well.
Awesome.
Yeah.
Vicki?
Well, my day is very sporadic. I don't really keep a routine, mainly because I like to fill my day with a lot of stuff and a lot of different activities. So basically, a morning for me, I do have a set part of the morning. So I get up, I shower, I get ready for the day. Then I take my dog for a walk, and then the rest of the day is kind of like what I need to get done in a day kind of thing. Like if I have to drive my brother to work, or if I have like plans or need to do paperwork. Some days are very productive, other days are not. It really depends on my mood. So sometimes I'll go out random day trips. Like it's very sporadic of what I do in a day, but I notice that if I'm left with nothing, or if I wake up later than usual, I am like in a depressed mood and very unmotivated, and like will just sit on the couch and do nothing all day. So I try to make sure I have stuff to do, so I'm more energized and more get things productively done.
Yeah. I'm kind of the same way, like around having a little bit of routine and stability built into my day, because it just helps me operate and more fluidly, I guess. If I don't get enough sleep, that really affects me, and I get either depressed or manic. So routine, I think, is really important for me too.
For me, if I sleep too much, that's when I get more manic or emotionally high. Otherwise, I plan something every day, because otherwise, I will lie in bed and pretty much just eat and vegetate.
I notice that if I don't have anything to do, like if I'm very bored, I will start to bounce off the walls and like get very negative in my emotions. Because I think if I have nothing to do, I kind of have to reflect on like past things, and I get into my head, and then it gets bad, and I notice my emotions kind of roller coaster throughout the day, depending on what's happening in the day. Like if I receive bad news, I notice that my mood will shift drastically right away, and it will be sporadic of when I'll be happy to sad. I'll be bawling my eyes out, crying about something, and then suddenly, like later, I'll see like something different or have good news or something like that, and I'll be like, oh yeah, today's a really good day. And it's very hard for my husband, because he's like, oh my goodness, like what's going on? So yeah, I noticed that I have to really watch my mood, because it's very rapid cycling.
Yeah, I was going to say, it sounds like it's rapid
Yeah.
cycling. Like for me, it's not as rapid cycling. It's more the longer periods of depression, or longer periods of like elevated energy or mood or whatnot. I guess hypomania.
Yeah, me too. I generally go months feeling really low, and then I'll go several months feeling high. But it kind of, rather than just being stable all the time, I still go through ups and downs, but not as dramatic as what Vicki's talking about.
Yeah, probably me too.
And more up and down than the average person.
Yeah.
Mm-hmm.
So I guess the next question would be, what do you do to manage your schizophrenia on a day-to-day basis? So Vicki.
So basically, I take medication to manage my symptoms. I get an injection once every 3 months, and that's the only medication I'm on right now. I used to be on a bunch more, but I was able to reduce them. And other than that, I still experience symptoms of my illness, so I do hallucinate quite frequently. But I know that it's a hallucination. I know that it's not real. And it's kind of just fact-checking is the basic thing, what I do for my illness day-to-day kind of thing. Other than that, I don't have delusions anymore. I don't have paranoia anymore. I used to have a lot of paranoia and delusions, but like I noticed that I don't have that anymore. That's very controlled by the medication, I think, or just me being more aware of the things and fact-checking. Other than that, I think that's about it. My day-to-day life is pretty normal otherwise. Don't have to do too much work except for the mood part, of course. But as far as the schizophrenia part is, it's a lot easier to manage now than it was before.
Yeah, I felt that too. The more education I had around the illness and the more self-awareness I had, it was easier to manage it. Do you do the fact-checking yourself, or do you have people who help you with that? Or
I do both. So if there's no one around, I fact-check myself. Basically, like the things I see for hallucinations that I see, sometimes I'll see shadow people standing over top of me in bed. That's kind of frightening, but I'm also like, I've been seeing this for years. I know they're not going to harm me. I kind of know that it's not real. Other than that, I'll see random things or hear music playing, and then if my husband's around, I'll be like, do you hear that music? And he'll be like, yes, no. Then I kind of know that it's either my hallucinations or it is actually in real life. So it depends on who's around kind of thing, right?
Peter, how do you manage your
I stick to somewhat of a routine with flexibility. That's the main thing. I take my medication as prescribed. I take medication 4 times a day through bubble packs, so it's well managed that way. I also, for me, I took cognitive behavioral therapy many years ago, and what I was trained to do was what's called facilitate reality checking, and that means checking in, is this really real? Like when I left my apartment today, I smelled like rotting flesh, and so I'm walking along the hallways thinking, well, obviously that's not real because the property manager would do something about it, and then I was like, but maybe, and then as I got outside, I was like, okay, this is a hallucination. I don't really get delusional. I still have some paranoia. I forget what they are, but when I ask one of my adult children, they'll say, well, this is what you're paranoid about. So a lot of check-ins. As far as mood goes, some things I do to keep my mood stable is if I'm feeling like a mood up or down, I distract myself with non-screen time, so reading a book, or I'll do some yoga, I'll bake. I distract myself a little bit. And then, like I said, I've got 3 children, so my 2 adult children, I will ask them from time to time questions and just confirm that it's real or it isn't real.
Right. Yeah, I do a lot of the reality checking as well. That really helps me either with myself, just kind of like doing what you said with the smell. I find it really hard to do with smells though. That's a really hard one for me to identify if it's reality or not, because a lot of the times smells are around you all the time, right? So
I've never had a smell hallucination. No, never. I've had the touch ones where I feel like my phone goes off, but I think that's very common. I think a lot of people actually have that in general, just in the general public, when they think their phone goes off, and they feel it buzzing in your pocket. I get that a lot. That's the only other touch one that I've ever had. But yeah, no, I've never had a smell hallucination. At least not as far as I'm aware of.
Yeah.
For me, it's auditory a lot. I'll hear somebody calling my name, and so something that I learned was just kind of, it's usually from the right side, so I'll just kind of go like this. And if someone's there, then okay, but usually no one's there.
Yeah.
And for touch, I still get sometimes, although it's a lot, it only happens every few months, but I'll sort of feel things crawling up my arms. So then what I was trained to do was just kind of act like I was a little bit cold, and then, okay, there's no bugs on me.
Yeah. Yeah, so you kind of learn these little techniques, I guess, to manage your illness and to do your own reality checking, I think.
Yeah.
So I guess the way I manage it is a lot of what you already said. So medication is a huge one. I still do get symptoms even while I'm on medications, like you said, Vicki. The reality checking again, making sure I'm taking care of myself properly. So employing good self-care strategies. So yeah, another one is attending therapy regularly. So I don't know if both of you do that as well, or?
Not anymore. I'd like to go and start again, mainly because I've been sick for so long and I've always been passed around a lot within the mental health care system, that I've always been with a registered nurse / therapist, and they don't really do therapy with me. They kind of just give me my injection and they'd say, oh, how are you doing? And then bye. So
it's hard to find a good therapist, and one that you connect with. And
I've noticed that all the ones that were really good went into private practice because they're like, they can make more money there, and it's very traumatic when they leave, because I'm like, they're really good and they actually like work with you and stuff like that, and then they leave and then you're just like, this is our last session, and then you're like, well, now what? Like, it's very traumatic to me anyway, that they're just up and leaving and then I never get to see them again, kind of thing, right? Even though we've built that rapport. So it's kind of frustrating, but at the same time, like, I gotta learn not to be so attached to my therapist.
For me, I haven't had a real therapist in years, because the last time I had a therapist was at a hospital outpatient unit, and I was seeing a resident, and it just got to the point where every 4 weeks it was different resident, same paperwork, like, here's how you deal with it. And even though I said I'm following all of that, however, I still have symptoms, it was always just, here you go. So I haven't had a positive experience. But I did have one good therapist, again, many years ago, and she told me, like, this is our second last session, and I'm going into private practice. So that it was for me too, because I only saw her for like 6 sessions, but it was just like, we built this rapport, and now you're just gone.
At certain buildings here in Edmonton, it's a constant revolving door of different RNs and therapists, and I just noticed that there's a lot of turnover, and I've been through many therapists, and it's not because I was bad or anything like that. It just, they didn't want to stick around, I guess. I don't know what the real reason was, but like, it was a lot of turnover. So it's very traumatic, kind of telling certain experiences to some random person that you're switched over to, like, every so often. So, and you kind of have to kind of retell your story again and kind of build that rapport again, and then they leave, and it's just, it's sad. So
and it's frustrating too, because especially with the revolving door, like for me, with always seeing residents before, each new time it was new resident, and they'd have to go over my file for 3 to 5 minutes, and then that eats up time. So then there's like a 5-minute consult, and here's your prescription, and it got frustrating.
It kind of just sends you out the door without kind of actually doing any therapy, I've noticed, especially in the past good couple years. Like at the very beginning when I was a kid, I noticed that I got actually a lot more therapy time to like talk to the doctors, talk to my psychiatrist and my therapist. But I noticed as soon as I got kind of better, like more well, they didn't want to spend time talking about stuff like that, I guess. They just kind of said, here's your injection, out you go. I mean, you're doing good, so, but I'm like, I want to talk about stuff. And it just kind of like, there's that disconnect, I guess, and it just needs to, I want to go back and talk and see if I can actually see an actual like psychologist or like actual therapist that will spend time to talk about the problems I have, right? But I'm not sure if that's possible, so we'll see. I haven't explored that route yet, but I'm looking into it.
So, I mean, there are a lot of holes in the mental health system the way it currently stands, but for me, therapy has been a really important one, and just like self-advocating to get a proper therapeutic relationship with someone has been really big. I guess another question would be, what do you find frustrating about living with schizophrenia or schizoaffective disorder?
For me, it's the chronic symptoms, like the hearing the voice, the smell, and then sometimes I'm delusional, and I never have insight into the fact that I'm delusional. So unless somebody tells me I'm delusional, I don't realize it. And then when I'm told I'm delusional, it's just like, I had no idea.
It's hard to hear that.
Yeah. But I appreciate the feedback when I get it, and that's been an important part, to be vulnerable enough to just have people kind of, in a healthy way, get in my face and say, hey, this is not healthy. But again, it's just the idea that even with medication and group therapy and and friends and family, it's frustrating because symptoms just keep on going.
For me, I think the most frustrating part is probably the mood disorder aspect of the schizoaffective disorder, mainly because the periods where I'm not in a higher mood and in that lower mood, and I feel nothing kind of thing, that frightens me, honestly. It's the worst. I hate not being able to be motivated. I hate feeling like there's nothing in me. Like that's the worst part of the illness. It's just that nothing feeling, that in between stage of like feeling high and low, and it's the worst because I don't feel anything, and then that's just not good for me.
Yeah.
It's not that I like the manic highs or anything like that, but I noticed that I feel something, and not feeling anything was the worst part, I think.
Yeah, being stuck in neutral.
Yeah, stuck in neutral.
That's another difficult thing, but it's one of those things where symptoms I've lived with most of my life, so it's just, I accept it. Maybe that's being too passive, but it's like, my mood's elevated. Okay, I'll ride this out, and then, my mood's really low. Like I know I present well right now, but my mood is low, and I sometimes have trouble waking up. I'll snooze my alarm for like 3 hours, and other things I do that show signs of depression. But it's nice to feel instead of flat.
Yeah. Yeah, feeling.
It's not healthy.
I know it's not healthy. Yeah, not healthy, but yeah, that feeling of nothingness is honestly the worst. It's not good.
I struggle with the flat affect too. And then also with the hallucinations and delusions. I find that frustrating too. But I like the positive spin you put on it in terms of like it encouraging vulnerability. And I feel like there's been a lot of personal growth from that. So, I mean, there have been, like, I like how you spin it to be a positive to the illness as well.
Yeah, thanks.
Yeah. So thank you so much, Peter and Vicki, for sharing what it's like to live with schizophrenia day to day or schizoaffective day to day. It was really great to get your experiences and your viewpoints on it. So thank you so much.
You're welcome.
You're welcome.
Hopefully you all found this video helpful. If you liked it, please give us a thumbs up. And if you want to see more, make sure to subscribe and check out our future videos. So thanks again for watching and have a great day. Bye.